I have problems in my neck, in my shoulder, in my entire back. But my big concern is that I have a vertigo 24/7 without leaving. They don't find out the reason. I've been seeing a lot of doctor, every kind of doctor, neurology, neurotology, otorhinolaryngologists, everything, and they don't find the reasons of my vertigo. I feel my ears popping. I feel pressure in my right side. I don't have balance in my right side. They're saying that I have nystagmus in the right side. They're having me doing vestibular therapy. That doesn't help. And my life is not the same. I think I'm passing away.
Okay. All right. So we're going to get to the bottom of things, take a look, see what's going on as well. Just to show to the viewer, right? This is all our medical records.
Yeah.
This is the first time I've ever seen a patient. Usually with really bad complex cases, we see like one bag like this, but first time I've ever seen a whole entire suitcase filled with medical records here, plus another bag over here, and countless of CD MRIs over here as well. So let's go ahead. Let's take a look, see what's going on. There it is right there. So that level is chronic. So this is, yeah, we have a chronic nerve right here. Let's go to the left. How's this fellow over here?
A little pain.
How's this side?
Less.
Less. So on this left sacroiliac joint over here, this fellow's swollen. So now we're tested. So when I compare it to the right side, this fellow over here is stuck. Tender right there?
Yes.
Yeah. How's this fellow over here?
Pain. Pain.
Got it. This is not completely fixated. So this may be a compensation that turns to subluxation. How's that fellow right there?
Pain. Pain.
How's that one right there?
Pain.
So this one over here, this third cervical, this is stuck. It's not moving whatsoever. So when we check for edema and muscle spasms, everything surrounding near this third cervical level. Next we check the atlas. So the atlas is slightly fixated on the right side. It's not fully rotating too well either. Okay, so it feels like we have an ASRA, this particular patient over here. So I understand that you've been experiencing ringing in the ears, okay? And the first week you had fluid in the ears, and only lasted about a week. You also felt like unsteady, like as if you were drunk, right?
24/7. All the time. Doesn't go away.
And your right eye, it's like shakes, wavers.
Yes.
And also a nasty headache on the back of your head.
Yes.
Right? And also from time to time your jaw pain, also on the right side as well. So pretty much everything happens on the right side.
In the right side.
Right. So everything you've been telling me so far, right, it fits what we call Meniere's disease. Right. So I'm going to break it down what it is. So in essence, simplified the diagram, this is the inner ear. Now we have two nerves that serve as a sensor for this fellow. That's what we call the vestibulocochlear nerve. One component deals with hearing. That's what the ringing ears, all that stuff. Other component deals with where we are in a 3D sense. Right? Now, this is getting compromised. Why? Because this inner ear is not functioning right. It's floating up with fluid. You also mentioned that sometimes it feels like a little trickle going down your throat, or you have to cough right back your throat. So from what it sounds like from your history is just that, yeah, you did have fluid in the ears. It really did filled up, and after a week just went down, but not completely because you still had that little unsteadiness.
Yeah, I still have.
Right. So I suspect that, well, that sometime later on it was draining out, but not completely. So something was causing this inner ear to get blocked up. There are two components that deals with that matter. The atlas itself, that's the very first bone. So if we find that there's a significant rotation, what we did on your examination, we tested it, you have a very anterior on the right head. I'm sorry, the right atlas. So it went older like this. That also helps explain your jaw as well, because this one also went along for the ride as well. Next component, we're also talking about this one right over here, trigeminal nerve. This particular nerve, the branch we're concerned about is this fella that goes into the roof of your mouth. That's the soft palate. The soft palate, if it's functioning properly, it'll allow the eustachian tube, which is a drainage tube from the inner ear to the mouth. So that soft palate, as long as it's working, the eustachian tube will open up. You'll have the drainage just fine. You don't even notice it. However, because it's partially blocked, that's why you start to feel a little trickle going down your jaw. Sometimes you kind of cough. Right? Atlas does the same thing matter as well. When it's pushed severely enough forward, it can also pinch off that eustachian tube, not allowing your right ear to drain properly. So the answer is this. We already found the problem. We tested it. That third cervical is not working properly. This atlas over here, that needs to be addressed in a future visit. That one we also need to address. Help reduce even more of that fluid. But there's several major ones that's relevant for you today. Your sacral foundation and that third cervical. So what's really going on? Let's piece it all together. Because a year and a half ago you had the gastric sleeve surgery. From 200 pounds, you dropped down to 120 pounds in a matter of 2 months. So because at the time, because of all that extra weight, what it did was it pushed your belly forward like this. So instead of your spine more off here, it's more forward like this way. So your body, what it did was biomechanically, it was compensating for that now position and all that extra stress. Right? Now, when you lost all that weight, it changed the biomechanics of your spine itself. So you're no longer pressured from here to now more upright. However, because your body was compensating for all that issues for a pretty long time, and we could tell because when I see your neck over here, I see multiple degenerative joints. From here, I want to see normal, but no, I see a lot of in between these two over here. There's a lot of structural damages in your neck over here. They're all breaking down. It should be a nice square shape or a rectangle shape. I don't see that over here. It's more trapezoid shapes all along here. So when that started to happen and you change the biomechanics and your body was trying to adapt to where normal is supposed to be, this area finally started to no longer adapt properly. And then it started to show up. And once all these nerves start to become dysfunctional, like this nerve over here that leads to your right eye nystagmus, then this region over here for the trigeminal nerve, soft palate, don't function properly. In addition to, I see your atlas, this bone, it's way forward. It's significant enough, we even see even your jaw. I want to see this one, the middle of it, in the middle of your spine. I don't want to see it jutting way off to the left. So your jaw is like this. I'm sorry, like all the way to the left. Why? Because your atlas went this way, your jaw went along for the ride as well. Helps clarify some stuff, right? So, in addition to your sacral foundation, that's 11 millimeters of misalignment. See, 0 to 1 millimeter misalignment, I don't care. 7 millimeters, that's when it becomes a problem. And a significant one. Your body has a lot of trouble adapting to 7 millimeters. But you have 11. So at 11 millimeters, it looks like this. It's like way over this way. So that's what we're seeing the rest of your spine over here. So we want to be straight like this way, but no, your spine went all this way. So, but the problem is we can't walk like this way. Right? It's kind of weird. So that's why the head had to go this way, even though the rest of your body is this way. So to center it, you start adapting, twisting over here. That's why you also experience this pain right over here as well. But since it over adapted, now your head's facing this way. Now somewhere in the middle needs to recenter itself. That's what we're seeing over here as well. And that's what we found in the structural test. Over here, yeah, it was painful, but it wasn't fully stuck. So that's what we talked about before. This is a compensation slowly and steadily turning into a subluxation. Starting to become into a future problem. But this is compensation. If we keep on following along the pathway from curve here, curve this way, curve here, and curve that way, the very first structure of the bone that helps to resolve this anteriority of your atlas is that third cervical. So that's the reason why your third cervical is in trouble. Because your bone over here, it should be centered, but no, it's turned all to the right. This atlas is also turned all to the right. You understand that? Whereas the rest of them are turned over to the left. So in order to help with that atlas, to center it, so to help drain more, that third cervical, to restore the trigeminal nerve to work better, to allow the soft palate to work more, to drain even more as well. That's why that third cervical, that's what we need to correct. Oh, you're not gonna fall away from me. Come up. Okay, go ahead, walk back and forth.
Better.
What's better?
The tingling.
Tingling where? Well, that's right. We forgot to add to that part. You mentioned about tingling both your hands.
Mm-hmm.
How's the right one then?
A little.
A little, but the left one's pretty much almost gone. Okay. I know. Breathe. That was a very deep correction.
A little less. I still have pressure in the ear, but less.
You also told me that you feel a little unbalanced. How does it feel now?
No balance. No balance.
No unbalance at all?
No. Just like a little.
How much little?
Like from 100 like to 10. The popping in the ear is not there.
Mm-hmm.
Just a little. But it's not like that hard. Mm-hmm.
Do you still feel the little trickle in your throat? Or do you feel it more?
Nothing in my throat.
Nothing. I'm going to let you know, because since we cleared that and restored the nerve function to the eustachian tube, right, and also for your inner ear, it's going to really start draining out more. So don't be surprised that within a couple of hours, you may, and it's going to vary from patient to patient. Some patients, it feels like there's a waterfall going down their throat. Some other ones, it feels like a trickle. Some of it feels like a stream or a creek. Again, it depends from patient to patient, but it's going to drain. Okay, so don't be surprised you start coughing out quite a bit more within the next couple of hours. All right, and then it should dissipate the next day or two.
Okay.
So this is your homework. This is what I want you to do. I want you to ice that fella, because again, it's chronic. It's been there for a long time. We've got to get some more swelling out of there. Ice it for 20 minutes, 3 times a day.
Okay.
And we'll see you the next visit.
In the first visit, I was 100% dizziness.
Mm-hmm.
This is my third visit, and I feel much less dizzy, like 40%, and I feel like I'm having my energy back.
Good. How's the ringing in the ears? How's that coming along?
Oh no, the ringing ears is like a 80%.
80% better?
Yes.
Okay. What about popping the ears? I believe you mentioned like
The pop in the ears sometimes.
Okay.
It was all the time. Now it's sometimes.
Okay.
Okay, I don't have no more lightheaded, no more dizziness, no more blurry vision. The vertigo is gone, and I'm not taking the medication for vertigos and dizziness anymore.
All right, sweet. Thanks for the updates.